to you today. But the main thing you always want to do is you want to make sure you got your Bovie. We'll put that over. And the first thing we want to do is always turn on what?
Light.
Okay, so turn on. This is light number 1. I'm using light number 1.
Okay.
So turn light number 1. You all don't need to push. You don't need to push that. Just turn the light all the way on. Number 1. Turn it all the way to 5. You turn always the OR lights all the way up to the total intensity. Doctors are going to move these where they want them, but for your prepping, you want to be able to actually see. So the first thing you do is get your lighting. Above your head, get your lighting. Next thing is the Bovie. Now, I'm going to put this Bovie on, but you all are not to, because the mannequin gets a little problem when you put it on him and have to keep taking it off. But I'm going to show you how you would put it on one of the things you don't want to do is put a Bovie on across, because you break the currents in the actual Bovie pad. And we want to put it closest to the area that you are going to work on in the OR. So if I'm going to work here, we usually put it somewhere around here in the hip area. Again, one of us that is a human would not have that groove there. That would be an area. So I can put it here, I can put it here, but I want it closest to the area where we're actually going to be working. Can you lift that up a little bit for me? Just make sure. And I want to make sure I get full contact. But the Bovie will let me know itself if there is no full contact. If I accidentally don't put this on beforehand, what do I do? What am I going to have to do?
So you're going to have to wait till it's all dry.
No, I'm going to have to wait and put this under, go with the flashlight or no flashlight, and go under the drapes if the surgeon has draped. That can be very tedious, but the surgeon says, could you turn on my Bovie? And you're like, I forgot to put the Bovie on. So then you tell him, I need you to wait a minute, I need to put on the Bovie pad. So you're going to go crawl under the drapes on your knees and put this pad on. So try and always remember to actually put the pad on. Now here, you see the 2 holes in the middle, it says patient. You're going to always hook this up first. And so each one of you, as you get ready to do your checkout, make sure that you put the Bovie pad on. But for purposes of reusing this, you all are going to keep it in the plastic and just put it under the patient's hip, because all of us will be using the same Bovie pad. Now, I would not use the kick buckets, but I would bring the hamper. I want to get all of my tools, get everything ready and closest to me that I'm going to need to work. So this would go in here, so that's going over there. And remember, these would not be here. I put these down so we don't have to do a lot of laundry. If you all get these wet and with all the betadine on them, one of the problem is going to be you're going to be in charge of the laundry detail for that set of laundry that you kind of soil. So we're going to put this here, and we're only doing this for purposes of making sure that we don't get the linen kind of messed up. And you be aware that you've got a pillow down there also, and you don't want to waste solution there. And remember, pooling can cause problems because betadine can become toxic if the patient lays in it, and it can actually burn. And I can show you pictures of holes burning patients that were pooled in betadine. You're going to take it also, before I do this, where's my patient's chart? Let me borrow that patient's chart. this, I think, and I actually have, Amy, the allergy slips in there that you actually say allergic. And you always want to make sure you check this before you double check again before you do it. Go into your history and physical and make sure that you know about this patient's history of any type of allergies.
What if they're allergic to betadine? What would they use?
Then you would use whatever the hospital has available, which is one of the ones behind you, the chlorhexidine gluconate, the one that's over there in the white bottle.
Okay.
And sometimes doctors use alcohol, but make sure you know for a fact, you look at the armband, you look at the chart to make sure that they are not allergic to iodine. And the chart would be in the room with you or with anesthesia. So it will be readily available to you. Now that we know our patient is not allergic to iodine, now I'm going to set up my prep. Now I would have my scrub over there, and my scrub can bring me some saline if I need it in an asepto syringe. And many times what we'll do is ask the scrub, once we open, ask the scrub, can you separate that and set it up for me? So on occasion you'll see the scrub come over and get this ready for you. Now you can use these gloves, but a lot of times these gloves aren't your size. So I tell them, take and you pick these up like this and remove them. Now I don't like to use these gloves, but if you feel you got small hands, these you can save some money and you can just pick these up. And notice what I did. I picked them up and I removed them. If I'm going to use them, then I would open them here. Don't throw any of this away. That's one of the reasons why I put it there, because you're going to clean up your prep, put it in the sink, let it dry, and rewrap it to use it again. And again, all the things you've been applying about 1 inch around the edge is still the same with your using your gloves. I made sure that anesthesia knows before I actually do anything that the patient is ready for me to prep. We make sure we cover the patient, remove the gown. Don't remove the patient's gown while they're awake unless they're going to have surgery awake. And remember, don't slide these. You notice I just picked them up and moved. Don't slide those across, because that's where you guys get in trouble. You just need to be worried about this portion of your hand. These are my dry towels in this set. All of this is sterile, so I can move it to give myself some room. These are my side towels. So I'm going to go ahead and put my little side towels down. And most of them, you notice, are very small on the side towel. If you work in cardiac, then you get the big ones. And I want to keep my hands under. And I don't reach across the patient to get my other side towel on. And excuse me.
Keep going.
And these are going to slide a little bit because of the plastic. But in the hospital, we don't put plastic. We just go ahead with the regular patient sheets, because we don't laundry the sheets.